Humans, it's Noel. Hope you're doing well. Day 3 of my quarantine. I'm fine. Actually, been busier than I would have thought with all the texts and the work and stuff. So, changes at the practice. With the COVID-19 pandemic, it's not realistic or appropriate for any of you to come in for routine care. So, no annual exams through April 10th, no medication follow-ups. For refills. What we're going to do is, as we call everyone to reschedule them for 6 to 8 weeks, if you're having an annual, we're going to refill all your hormones or anything you need. It's that simple. If you're someone on a controlled substance that has a scheduled follow-up, we will refill the controlled substance for a month and coordinate via the phone each refill and touch base through a phone call or telemedicine. Right now we don't have a telemedicine solution, so it may be a phone call solution and we just chat on the phone, then refill it. But we do not want anyone coming in for non-medical urgent needs, meaning you're having a problem. If you're sad and depressed, you're bleeding heavy, you're having pain, you're having migraines, you have something that is affecting your life negatively that you need our help for, it's vaginitis, whatever it is, we're happy to see you. We just do not want people who feel totally fine to come into the office for a checkmark visit on something. So we will refill meds for you. That process has been set up. You do not need to call. Calling will just screw up the plan. We have hundreds and hundreds and hundreds of patients a week that we're going to have to start calling. So we have started that now. We will continue doing it and you will be called. If at the time of your appointment you haven't been called, then you can call. That would be fine. We are going to be well ahead by Monday or Tuesday and probably have the first week or week and a half done already. So we're on it, we're focused, we're going to get your refills done, we'll figure it out. So it will be done. The second part about that is be nice. If we aren't getting it done, call and be nice. Do not be mean, rude, inappropriate to the staff. The staff are working through a pandemic. They're putting their lives at risk for you. We have no tolerance, meaning I have no tolerance for anyone who's impolite during this phase. All of us should be perfect. We should be kind and polite to you. That's my normal standard. If anyone isn't, let me know. But by the same token, if you are unkind, rude, abrupt, or yell at any of the staff, I will terminate you. You need to understand there will be no second chances during this phase. The staff is putting their lives at risk for you, so be respectful and be nice to them. We're going to do everything we can to help you through this, but I always have told people forever that I believe niceness matters. And so I don't usually demand that from everyone that I'm seeing as patients, but I'm going to say it is expected from you too now, because our staff is putting their lives at risk. I cannot emphasize that enough. So we want them to be respected and cared for. So even though you're scared, even though there may be a snafu here and there, be nice. You catch more flies with honey than vinegar. If you have problems, just call in. The staff calls me all day long with problems currently. I hopefully will have a negative test by Sunday, since it is taking forever to get a test result because we're in the state of Oklahoma and there's just no testing or testing results quickly, which is a little bit frustrating for all of us. But anyway, take care. We'll be doing our best for you. Hopefully this will blow over eventually. I'm anticipating probably 60 days to 120 days before we're going to be doing annuals. So we're going to schedule things out at 6 weeks on the off chance this does not turn out to be as bad as I'm anticipating. But if it's looking like it's going the way that Liz Sprite predicted in her modeling, which I've referenced earlier, which we'll know in the next few weeks, then we'll basically push everyone's appointments for routine things back till August. But we'll have a plan to refill everyone's stuff. So I hope that helps. Stay calm. I feel very calm about this. We're organized. You all should all be on zinc. You should be on melatonin. And you're going to be in great shape. Take care. You're in my prayers.